Contingency management is a behavioral treatment that uses rewards to reinforce positive behavior. It can be used to help people reduce or stop using drugs. Effective contingency management for methamphetamine use typically involves a 12-week program that provides people with incentives, such as monetary vouchers, for methamphetamine negative urine tests. The value of the voucher increases with each consecutive methamphetamine negative urine and resets for a drug-positive urine. Urine tests are done 2 to 3 times per week. For the first methamphetamine negative test result, the client gets a small incentive, say $5. If they provide a second negative result, this goes up, say to $7.50. And for a third, it increases further, for example to $10. If the client does not provide a methamphetamine negative test result, the incentive resets to $0 and they start over. There's also a prize draw version where clients can score draws from a pool of prizes. Contingency management was developed in the USA, where it is shown to be among the most effective treatments for reducing methamphetamine use. Recent software developments have made it easier for clinicians to implement contingency management. These have supported the increasing use of contingency management to treat stimulant use disorder in the USA. However, it has not been widely used in Australia. We interviewed people who used methamphetamine and found that they were interested to try contingency management as a new treatment option. We were therefore interested to find out what frontline alcohol and other drug workers thought about contingency management and whether it could be implemented here in Australia to help people reduce or stop using methamphetamine. We conducted focus groups with staff from 6 alcohol and other drug health services around Australia, totaling 37 staff, to hear their thoughts. The health service providers that we interviewed felt that it would be beneficial to have an evidence-based treatment for methamphetamine use disorder. However, there was some unease that contingency management would conflict with their client-centered harm reduction approach to care.
You don't want to undermine the relationship you already have with clients in terms of conflicting it with drug testing. It would be better off done outside of the service.
As a counsellor, paying someone to attend treatment makes me feel so uncomfortable because we're a voluntary service. I understand that they would be voluntarily coming, but yeah, I don't know.
There was also concern about the public's perception and the political acceptability of this treatment option, who would fund it, and the inequality of providing incentives only to clients with a methamphetamine use disorder.
The optics of it are a concern too. I can see some really negative types of press headlines.
I think the inequity in being unable to incentivize people across the board in a treatment setting where we're offering such a range of treatments would potentially cause some trouble.
It was considered imperative that counselling be part of the program.
I think contingency management would be fantastic in conjunction with psychotherapy or therapeutic interventions because, at the end of the day, substance use has a lot to do with mental health or emotional distress.
Participants expressed that some of these concerns could be addressed if the goals and structure of contingency management were also tailored to a client's needs. Overall, health service providers were keen to offer an evidence-based treatment for methamphetamine use disorder, especially if it were implemented in a way that was tailored to client needs so that it did not adversely impact the therapeutic relationship.